Hi, my name is Mila Brujic. I'm a partner of a three-location practice in Northwest Ohio, and I had the opportunity to present a poster on a new daily disposable toric contact lens. And this was kind of an interesting study. So it wasn't a controlled trial, so we didn't do it against a specific separate lens design, and it wasn't something that was masked. With this new technology made of calophyllocon material, we realized that the predecessor lenses in this category made of calophyllocon A, just the standard sphere and the multifocal were performing well. We actually wanted to get some real feedback from patients. Once we got it, essentially, for lack of a better way to describe it, in the wild. So over 10 practices were involved in this, and we all recruited several patients and we gave them questionnaires. And these questionnaires asked about several things after they had a chance to utilize these lenses, specifically things on what was your vision like during physical activities, during digital device use? What was the comfort like? What was the total eye fatigue that you experienced? And would you continue with this lens? Because we wanted to know from a real world perspective what we could expect. And not surprisingly, all these findings were relatively positive for these patients.
Whether it was previous studies or trends that these lens wearers experience, what prompted this investigation for this study?
Yeah, it was interesting. So, whenever you see a new material and a new design come out, really the impetus for a lot of these new designs is to do two things. One, provide a more comfortable wearing experience. That's always the thing with every contact lens wearer. Every company is trying to create. And the second thing is, how do we optimize the vision? And this is such an important thing with the astigmatic wearer, which is what we were really targeting with this lens study. So again, you had this kind of combination of two components to this lens where it was a moisture-rich lens. We saw the improvements that people with spherical prescriptions and multifocal prescriptions were experiencing. Now we wanted to see if that transcends into the toric patient, because again, the toric requires stability on the eye as well too. And what we found was there was over 200 patients that were in this study. We found that the individuals who actually complained of dryness actually benefited the most. So interestingly, when the patients were asked about like, how do you feel about all day comfort with this lens? Both groups, just the patients that were just normal contact lens wearers that they were receiving a new option, felt very comfortable with them. But the dry eye patients actually reported better outcomes. So it actually shows us that those people that need the technology more will physically benefit more subjectively from it as well too. So it was an extremely interesting finding. So we're always looking for those patients that are symptomatic and how we can improve their wearing experience more so. And we seem to have proved it with this new material and new technology.
So given the importance of comfort for these wearers, what should practitioners consider when they're fitting daily disposable toric lenses in patients who report these dryness symptoms?
That's such a good question. And it's a good question because a lot of times that's not the problem. If they're reporting them, those are the patients that are easy to kind of move into newer options. It's oftentimes these patients who just wear contact lenses and become subjectively numb to the way that contact lenses and the lens wearing experience is. I always ask a question of patients, and I started this about a decade ago, asking them on a scale from 0 to 10, rank the level of comfort of your lenses. 10 is the best you could picture your lenses feeling. 0 is the worst comfort you can picture. At the beginning of the day, about 5 to 10 minutes after you put your lenses on, most patients will rank that an 8, 9, or 10 at the beginning of the day. Then I say about 5 to 10 minutes before you take your lenses out in the evening, what's that same comfort level? Or what's the comfort on that same scale? And oftentimes there's a precipitous drop. And then I asked patients, what would you think if I could actually make that end of day comfort better for you? And they said, yeah, I love that. And that's when we start into the discussion of the newer materials. So again, I think it's the person that comes in actively complaining. Those are people that we can give options to. It's the person that doesn't come in actively complaining that we ask that one additional question that gives us insights into their true wearing experience. And then we have the impetus and the platform to to provide them those newer options.
So, what would you say, given the results of this study, are there still any questions that remain unanswered regarding how to best cater to the comfort for these patients?
I do. And, this specific study looked at contact lens wearers, and they were current contact lens wearers. And it looked at simply the effects of changing the material to something that's a newer generation material, has osmoprotectants and electrolytes within the material, and how that actually functions for those patients. There are still other questions that remain. Well, what's the influence of the ocular surface health on contact lens comfort? And that's something that wasn't explored and looked at this study. And I think it's really, from a clinician's perspective, taking a big step back, asking ourselves, what should we be thinking about? There's two things that we should always be considering for individuals that want to wear contact lenses as successfully as possible. The first is making sure that the lens itself is the highest level of technology. And the second is optimizing to the best of our abilities the contact or the ocular surface that the contact lens sits on. And I think that's ultimately going to give patients the best outcomes.
Anything else on this study that we haven't touched on that you want to touch on?
But the only thing that I think that this really kind of peels the layers of the onion back on and provides us some level of unique insight into is that regardless of how happy some individuals are with their lenses, there may always be room for improvement. So when those newer technologies come out, don't be afraid to try those out and test those out on patients who you may feel may benefit from them.